Brain balance in mold illness. This is a huge, huge part. I know there's a lot of concern about cleaning up your home, about getting toxins out, about killing mold in your sinuses, but we've got to focus on the brain as well. This is a kind of the different steps that I do when we're worked with people recovering from mold. Nutrition, healing the gut, immune, infections, detox and drainage. But brain balance really should be like a big arrow and a place to start. And this is not in chronological order. These are things we're working on all at the same time. Because brain symptoms is a big part of mold illness. Foggy brain, forgetfulness, trouble learning, lack of insight, and not realizing that mold is actually contributing to some of your symptoms. Irritability, trouble making decisions, and mood fluctuations from irritability to anger to crying to desperation to happy and all over the place. These are some of the most challenging symptoms. Um, they're real. We know that toxins affect our brain. We can actually do a visual challenge test or a VCS. This is actually what it looks like, where you're looking at different orientations of light colored lines and darker colored lines, and people who are exposed to mold toxins have difficulty discerning the lines. That is a free test you can do online. And this is what the report looks like. It is an option to follow in your recovery, but it's not critical. We don't have to always do this test. But we have to think about there's two things going on. The brain gets stuck in a protective cycle. The lizard brain is trying to protect us, but also the brain tells the immune system to be in a protective mode, and then the immune system gets activated and even stuck. And that affects the hormones or the chemicals or the neurotransmitters in the brain. So first, I want to talk about the limbic system. These are actually structures in the brain that I call the lizard brain, and they are involved in memory, emotions, behavior, smelling, and vision. I call the limbic system the lizard brain or primitive brain, and then the tail is the vagus nerve. And really, all the little lizard wants to know is, am I safe? And the lizard remembers events so that it can prevent that from happening again. So here's an example. So you're taking a walk, beautiful day, a dog starts barking and chasing you. Lizard brain learns and remembers dogs are not safe. Then we have this fear of dogs. We also get a normal stress response. Our heart rate goes up, our brain goes into protective mode, not thinking mode, not time to think about what's for dinner. We start to sweat. Our bowels start to slow down because it's not the time to digest or move. And we see a lot of this in mold-related illness, where we get heart rate going up for no reason and we're sweating for no reason and we become constipated. So that lizard brain still remembers smells as well. So even if our big thinking brain doesn't register that as a mold smell, the lizard brain says, oh my goodness, that is the smell of mold and I'm not safe. And every time we are around toxins, whether our big brain realizes it or not, our little lizard brain freaks out and says mold is not safe. And we get those same symptoms of constipation, flushing, brain fog. And we get stuck in these patterns of worry and negative thinking. And that is the lizard brain trying to protect us and remember things. And unfortunately, the brain chemistry kind of becomes addicted to worrying to protect ourselves. So we have to break some of those cycles. Our thinking brain needs to tell our lizard brain, hey, we're safe. We need to interrupt those patterns. When we start to have, oh my goodness, I'm never going to be well again, stop. Whoa, realize it. Look outside. It's a beautiful day outside. The breeze is blowing. The sun is shining. If it's raining outside, you can look inside and say, oh, this is my home. And there's a beautiful picture, or here's pictures of my family. So interrupt those thoughts. Back to, there are two things going on. One is the brain, getting stuck, but also the immune system gets stuck. And that's when we get a lot of these cough, asthma, allergies, headaches. I just don't feel good, fatigue, and joint pain. Um, so we have to unstick the immune system as well. So, what can you do to help your brain? First, understand you're not crazy. Make sure you get good sleep. And I know that's a challenge because mold toxins cause us not to sleep. Work on de-stressing. I know that's a challenge, especially if you're remediating your home, raising children. Do the best you can. And then we're going to talk about brain training. There are some programs you can do to reassure your limbic system, your lizard brain. There's different ones. You got to find what works for you. A lot of these will have trials that you can try to see if it resonates or if it feels good for you. One of the most common ones we use in mold illness. I'm actually going to start in the middle. Some of the older ones we've used historically were DNRS by Annie Hopper. This people need to be able to do some physical movements. There's physical movements and some thoughts and even some humming. Um, Gupta program is a lot of meditation. Those are for people who are very fatigued and who can just sit and listen to meditations, and that's about all they can do. Some people who are more, their brain is just going all over the place, have a big challenge doing the Gupta meditations, in which case, one of the other ones, like DNRS or Primal Trust, might work for you. Primal Trust is a little bit newer. It's got a lot of education, a lot of videos that you watch, and then you learn. And then she also has some exercises that you do. And I'm going to share you a little bit of her material in a minute. And then there's a new one I've just learned about for Christians. I am a Christian, and I get that sometimes some of this is a little new age for people. So there is Limbic Rewiring by Brooklyn Hanna that is Christian based. So those are options. And I do recommend in picking something for the limbic system. Very important. So from Primal Trust, we did talk about interrupting those thought patterns, being aware that you're having the thoughts. When you do breathe or move, get up, move, walk, and when you breathe from your belly, being present now, looking around you, realizing you're safe, as we talked about. Um, Another thing for limbic system that's in Primal Trust is the Rosenberg exercise. Eye movements. And I'm going to show you, there's videos you can get on YouTube, and I'll show you a little bit about what it looks like. These are very good, especially if you're having vertebral instability, which can be part of mold-related illness, mast cell activation syndrome, Ehlers-Danlos, and tick-borne illnesses. That you go to the chiropractor and your vertebrae just won't stay in alignment. So this is what his video looks like. You see he's just sitting there with his arms behind him. You turn your eyes to the side, doesn't matter which side, for until you yawn or yawn or breathe or swallow. It can be 10 to 60 seconds. And then you turn them to the other side. I actually do this when I'm still laying in bed, and that's for some people that get dizzy is a good place to start. And you're not turning your eyes thinking, okay, when am I going to yawn? Just relax into it, and it will happen. The other thing we need to talk about is the vagus nerve. As the tail, the limbic system and the tail, they're two parts and they both need to be addressed. Craniosacral work is a very gentle way to make sure that the spine is in alignment so that the vagus nerve is flowing very well. Sometimes we'll also do some vagal nerve stimulation. In our office, we have a little device that's down here in the bottom. It clips onto your ears and it gives you an electrical signal to your through your cranial nerves to your vagus nerve. Can be very calming. There's also a newer device that Dr. Nathan recommends called Apollo Neuro. It's this bigger picture. It's something that you wear on your wrist and it vibrates. And you can change the settings for calm and sleep and unwind. And it has an app on your phone. Um, Also for vagus nerve, we talk about things like breathing. You don't have to have a device for these for the vagus nerve. If you want to just focus on breathing, breathing with your belly, um, uh, that your belly goes out, not just your chest, and trying to make sure that your exhale is longer than your inhale. Now, sometimes when people are still in a moldy environment, this freaks out their lizard brain too much. So just be aware of that. Brain breaks. You may think that you are more productive if you just push through things, but you're really not. So after you've worked on a task for a period of time, take a break, look outside, do something different. These brain breaks really do help your lizard brain feel that it's not having to just keep going and going and going. Stop and pause and look around and clear your mind before going back to the task. And using your senses, noticing the sights and sounds and feelings, that's a great way to reassure your lizard brain that you're safe. That's what lizards do in the wild. They're always looking around themselves and remind yourself that you are safe. Even if you're uncomfortable, even if your head hurts or you've got a sore throat, just say, acknowledge that feeling, but reassure yourself, this is just where I am right now. I know it's uncomfortable. We're working to get this better. How often should we do these exercises daily? Often some of these are just a few minutes, maybe doing it a few minutes throughout the day. Morning is always a good place to start, to set out with a good intention of calming your brain. If you can go outside and be in nature, that's always the best if the weather is cooperating. The end of the day is also a good time to end with gratitude, watching the sun go down, the color changing of the light, and just a moment of gratitude. Great research on gratitude, on how it can help our limbic system and our overall health. And do these exercises even more when you're stressed.